core's job is to stabilize your pelvis and your spine, right, which stabilizes your nervous system for movement, and also to control pressure, because everything that we do, loads that we add to our body, impact that we add to our body, does add some pressure going through our center, right? That's what it's meant to do. And our core is meant to be able to control that pressure and stabilize it. When we have an imbalance there, and there's something either not doing its job quite as well, or something overcompensating, or some kind of compression in this pressure system, we can have symptoms. So what this core cylinder is made up of, in the front, like imagine the front of that cylinder, you've got your abdominal wall, right? All the muscles are of our abdomen, including the fascia that connects it together. We also look at the connective tissue line that comes down the center, because that is where everything attaches to itself in the front, because we don't have any bones here. And so we need to have good integrity of that connective tissue line, and how well does it transfer force side to side, right? So we look at that. And then on the base of this cylinder, we have our pelvic floor. And it's not just the squeezy muscles down there. It is a whole system of muscles and fascia at the base. And your hips, the way that your hips and pelvis are oriented, make a difference as well, because those are all the attachment points. So that's the base of your cylinder. In the back of your core cylinder, we have our spine stabilizers, and actually all these core muscles wrap around to the back as well. So we've got the continuation of that system. And then on the top of this cylinder, we have our breathing diaphragm. Breathing diaphragm and pelvic diaphragm, pelvic floor, are often overlooked as a part of your core, but they are an integral part of your core, because they're related. So when we have movement, when we have pressure control, when things are going on in our center, we need to have good movement, an ability to move of breathing diaphragm, good ability to move of the pelvic diaphragm, as well as stability through here. So we are going to look at those different components in the next video. So we're going to start with alignment, and just remember, so besides classic, right, we always think of our abdominal wall as our core. We also have our breathing diaphragm, which is a broad muscle at the base of our ribs, right? And so it's kind of like this. And when you take an inhale in, it comes down to fill your lungs, right? And then when we exhale out, it comes back up, and it comes back up in this domed position. So we have this descending and ascending breathing diaphragm, right? Now, to match that, pelvic diaphragm, which is also part of pressure control, and our deep layers of our core, needs to be able to descend and ascend, right? It's about that flow. We need to get that flow in our body to have good connection. So we're going to look at that. So breathing diaphragm is a broad muscle system, and pelvic diaphragm is a broad muscle system. So just imagine those as a cross section through your body as we go into the next video.